My name's Anthony Rixon. I'm a skin cancer doctor and a cosmetic physician. I've been lecturing in the Advanced Certificate of Aesthetic Medicine. Lasers in cosmetic medicine, particularly in relation to vascular conditions, pigment conditions, laser tattoo removal and laser hair removal. I'm seeing GPs that have had previous experience in skin cancer medicine that are looking to branch out into aesthetic medicine. With lasers there's a lot of physics involved, and so that can be quite a bit of a headache for people. We're finding that by doing the practical component where we literally have a laser in the room and go through the treatment and show people what we're doing and what safety we need to do and what endpoint we're looking for, it really cements the knowledge quite nicely, and I'm finding the delegates are responding quite well to that. There have been some doctors that have found this course, I think, is a great way to get an understanding of lasers and made them more confident. They do go out and purchase a laser, and now they're off, building a cosmetic practice. I'm involved with tutoring in the injection of dermal fillers and botulinum toxin. The delegates get to practice on pigs' heads and learn to use different types of injecting techniques, cannulas versus needles, and just generally getting a feel for how to inject filler. And that's a good start for them so that they can then go on and do further training in injecting in people. So this is the sort of the intermediate level course. There's one before this and then there's one after this, and it's a stepwise progression that you go through in order to obtain a professional diploma.
When I get back from the practice, my head's always buzzing, so I find that I'm able to implement majority of what I have learned pretty much straight away. And that's the beauty of studying and working at the same time as a GP, is that you don't have to wait to finish something. You can pretty much go back to work and go, I know what I'm doing now. Or a lot of the time what I do is I just ring my patients and say, now I can help you, come and see me.